Do you mind telling me a little bit more about yourself, like your age, your living arrangement?
So I'm 66 years old.
Okay.
I live by myself. I have a daughter, but she lives all the way across the country.
Okay.
I really like my independence, so I like to do things for myself.
Okay, that's great. So I understand that you just had a compression fracture in your middle back, and that you've been feeling a little bit of pain. You can still walk around and do everything on your own, but what are some things that maybe you really enjoy doing, or that you do around the house that it either hurts a lot or you're having more difficulties with due to the compression fracture?
So I like to cook for myself. Like I really like to cook. Um, Once a week we have a book club who comes over to my house, and I like to cook for them.
Oh, that's great. Okay.
Let's see. The other thing is doing laundry. So that's really hard for me to do. So I do laundry about once a month, and so I can't do it because it's just so painful.
Okay, and something that's important to you, you like
Yeah.
to look nice, and it's perfect. So we're gonna work on a couple things and see what we can do for you. Okay.
Okay.
You mentioned that you love to cook, right?
Yeah.
Okay, great. So the first place that we're going to start is in the kitchen. Now, before we actually are able to do anything or adapt any of the ways that you do any of your cooking, we want to look at the way that your kitchen is organized. And the reason why we want to do that is to see what items or what food it is that you use most frequently on a daily basis and what you don't, so we can prioritize what's more in your reach. You would want to avoid any sort of spontaneous or jerky movements, so you don't want to be reaching down too quick or up. And you want to avoid any sudden movements of your trunk. So we're going to try to put into reach things that are very easy for you, things that you are interested in and that you like to use on a daily basis. So can you tell me something that you enjoy doing? Let's start with breakfast, right? So you wake up, and what's something that you do every morning for breakfast?
I really like to drink coffee.
You drink coffee?
Yeah, I have morning coffee every day.
Okay, great. And where is your coffee?
Right here.
Right there.
Yeah.
Okay, and are you able to reach there okay?
No, it's painful. It's too painful for me to get it.
Okay, and where's somewhere that you do feel comfortable reaching to without pain?
Let's see. I can do about here.
There's
I
good?
think this is, yeah.
Okay, good. So we want to stay within those limits. So maybe we can start with these oven mitts. Maybe we can organize it somewhere closer to the oven. Do you use this very often?
No, I haven't used that
No?
in years.
Okay, great. So we can go ahead and put this somewhere else, maybe on the higher shelf. Do you use sugars and stuff like that for your coffee?
Yeah, I do.
Yeah, okay, so we'll leave your mugs here. We can bring your coffee and your sugars. We can go ahead and put these here. Okay, so we can go ahead and put this back here. How does this look? Are you okay with this? Are you comfortable with this?
Yeah, actually, I think it'd be easier to get my coffee now.
Okay, perfect. That's great. So we can go ahead and move on with the rest of the kitchen. You mentioned to me earlier that you love to cook different variations of pastas because it's easy for you to make in large quantities when your friends come over. What is something that you feel you're having a difficult time with?
For me, it's really hard to carry the pot of water, especially to and from the sink, and then also when I have to drain the pasta.
Okay, I understand. When it's filled with water like that and the pasta, it's probably really heavy for you. Puts a lot of pressure on your back. One thing that we can do very easy using stuff around your kitchen is you can grab a towelette that you have around and then place it next to it. What we're basically going to do is, instead of carrying the pot, we're going to place it on top of here to make it easier to slide. And we're going to go ahead and we're just going to push this across the counter. And we're going to get to and from the stove and the sink in that same manner. Now, before you do that, you want to make sure that the area is clear so you're not dropping anything, fumbling, so you don't hurt yourself. You can grab a mug or cup or anything like that, and you can fill up the cup with water and empty it into the pot. And you can just keep doing that until it's the amount of water that you would like. And then once it's full, you can go ahead, if you want to go ahead and give it a try, and you can just pull it back to the stove like that. Good job. Perfect. Was that a lot better for you?
Yeah, that was a lot easier.
So now that you cooked the pasta, can you explain to me how you normally go about the rest of the cooking?
So I take the pot and I usually dump it over the sink, over a strainer.
Well, that might cause you a little bit more pain now because of the fracture, the pot's heavy with the water, same thing carrying it from here to there. Even though it's a smaller distance, another thing that you could do is put a strainer over a large bowl. It might take a little more time, but it'll feel a lot better on your back, allow you to heal. You can grab a tomato and you're gonna scoop the pasta out and put it over the strainer. That way you'll have it over here. It's a lot easier. You don't have to carry and lift this over the sink. So do you use a refrigerator as well?
Yeah, I have a lot of my fresh ingredients in there.
Take a look in here. Have you any difficulties in the fridge?
It's really hard for me to bend down and reach things at the bottom now.
Okay, so we want to avoid having you bending over if you don't need to, especially when you're carrying things, putting the weight and bending over. So we're going to do the same concept as the rest of the kitchen. We're going to go ahead and move stuff that you use more frequently, things that you enjoy eating more often. We're going to go ahead and move those from the bottom. We're going to put them up in the higher shelves, maybe in this drawer. Same thing with the condiments. If there's stuff here that you don't really use that often, we can put it somewhere lower, further back, and that way you give more room for stuff that you do use frequently. So it's easy for you to reach and you don't have to move your back in any way that can hurt you. Also to keep in mind, maybe when you're in the grocery store, do you enjoy buying juices or milk?
Yeah, I buy like a whole gallon of it.
Okay, so maybe instead of buying the gallons, because obviously the gallons are heavier, we can go ahead and get the half gallon so it's a lot lighter for you to pull in and out of the refrigerator. You do your laundry about once a month. What is it that you're finding having difficulties with this?
It's really heavy and I'm really, like, it gets me tired.
It gets you tired,
Yeah.
and I bet that probably puts a lot of pressure on your back and it
Yeah.
hurts. Okay, so one of the things that we can work on, and then you do it once a month, maybe you don't enjoy doing it that often, but nobody really enjoys doing laundry, but one thing that we can do that will really help alleviate that pain and help with the fatigue to reduce is that instead of doing it once a month, the problem is you let the clothes will accumulate a month later. If you do it more frequently in smaller loads, it'll eliminate that weight factor for you. So it won't be that heavy. So maybe instead of doing once a month, giant loads, maybe once a week or once every 10 days, your load will be about a third of the size of what it is, a lot lighter, a lot easier for you to carry. Okay?
Okay.
Another thing as well that we want to keep in mind is where do you usually, what's your next step after you take out your laundry?
I fold my clothes over there in the couch.
Okay, you like to take it from here to your living room or the
Yeah.
couch? Okay, so again, what we had just mentioned, it'll be a lot easier for you if you do it more frequently, smaller loads, less weight. But you can also get, they have these carts that if you don't want to carry any weight at all, if you do feel that you have a lot of pain, it's good to listen to your body, listen to your pain. If you're feeling a lot of discomfort in your back, it's probably because you're doing something that could further injure it. So we want to prevent that. So you can also purchase these carts. If the less weight is not enough, you can purchase these carts and you can place your laundry basket on top of here, and that way it's easier for you to commute from your dryer to your living room. Okay? Okay, Marvy, another thing that we can address as well, we had kind of mentioned earlier, you want to avoid any excessive twisting or reaching, bending over, because you don't want to put any of that extra pressure on your vertebral wrist on your back where you have it fractured. We want to let that heal. So one thing that we can do, I see that your dryer is very low here. I'm sure that was fine before. How do you feel with it now when you use it?
For me, it kind of hurts a lot when I have to bend down to get my clothes.
Okay. One thing that we can do is we can go ahead and we can pull up a chair. So we can grab the chair right over here, and you can place it if you want. You can go ahead and take a seat there, and you can open your dryer. You do want to position the chair. You want to make sure that you put it close enough where it's comfortable. You don't want to be reaching out too far because then you're kind of throwing off your balance when you're getting out of that center of gravity right under you. So you want to perhaps put your chair a little bit closer. Good, and have your feet flat back. Okay, Marvy, so this device is called a reacher, and it looks a little bit funky, but it's very, very practical to avoid any of doing that excessive bending or even reaching up high for lighter items. All you do is you pull it right here, and this kind of works as a hand, so it helps you reach things. So if you want to go ahead and try it out, and this will be great for you to use. If you have the chair, it'll avoid that fatigue, so you're not standing for a long amount of time with that weight on your back from your body. With that, you can go ahead and reach into the dryer, and that way it's easy for you. You don't have to do much bending of your spine. You can reach into the dryer, you can position your basket anywhere where it's comfortable for you, and that way you can go ahead and you can grab and you can put things in and out in the same manner. And again, since you're going to be doing it more frequently, less smaller loads, it'll be easy, so it won't take that long. It avoids the twisting, it avoids the weight, and this would be a great way for you to adapt some of your daily tasks. How do you feel with this? Do you feel comfortable using it?
Yeah, I think I'll be fine. I don't think I'll get tired.
Okay, that's great.